Welcome to HFI training video for Level 2 in gym instructing. My name is Alison Hall and I'm hoping to help you to perform well and pass your practical element of the Level 2 gym instructing. There will be clients coming in to this DVD from time to time who will be role playing, so try to look at it in a realistic fashion as best you can. The assessment is split into two parts. A formative assessment and a summative assessment. The formative assessment will take place at your workshop. The summative assessment will take place on your assessment day along with your theory assessment. The summative assessment is also split into two parts. The first part is when you're observed teaching your client in the gym for 1 hour. And following that, you will then be assessed on your evaluation skills, and you will evaluate yourself and the session using your client feedback. You do have to pass both parts, the observation and the evaluation of your session. The formative assessment is comprised of a CV machine, just generally, and one resistance machine and one free weight exercise and a body weight exercise, and that will take place at your practical workshop. Your summative assessment takes up to 1 hour and is comprised of a general warm-up, which is comprised of a CV warm-up, followed by joint mobilization and or muscle short stretches, either static or dynamic. Following the general warm-up, you will be assessed on a CV curve, so that's a workout for your client that is tailored for the right intensity for that particular client. Following the CV curve, you will present 3 resistance machine exercises and you'll be assessed on those. Then you'll be assessed on free weight exercises. One of those free weight exercises you must role play with your client being a novice and show safe passing and supporting of those weights when they pass over the client's head or their face or their neck. So one of the exercises must be planned to meet those criteria. Following the free weight exercise, you will be assessed on one body weight exercise. Not a core stability exercise, but a body weight exercise, like a press-up, something like that. Following the weight training, the resistance training, you will do a CV cool-down, and then you will present 3 flexibility exercises, either for maintenance of flexibility or for development of flexibility. Then you're expected to end the session with your client, giving them feedback and asking for feedback from them, and you will complete a self and session evaluation form which you have in your LAP, and you can look at the questions there, and you have 15 minutes to fill that out, and that is actually part of your assessment, so you must fill that out completely, and you will take that along to your debriefing with your assessor in about 20 minutes time after your assessment, and you will talk through that with the assessor. Before you begin your assessment, you will have the opportunity to talk with your assessor. He or she will brief you fully, but you will also have the chance to ask questions about anything you like before you start. Please do ask questions before you start. The assessment is based on the checklist which is in your Learning Achievement Portfolio, page 39. And this is what the assessor is marking you on. The scoring criteria there are free for you to practice against and look at before you arrive. You need to bring your completed Learner Achievement Portfolio with you, your LAP, and of course you need to bring your pre-screened client with you. The questions that the assessor will ask you about your performance and about what you were doing in the test is actually done at the end, so the assessor will not interrupt you during the test, and they will try to stay back from your eye line and try to be as inobtrusive as possible, but they will need to be close enough so they can hear you, so try to make your voice heard by the assessor otherwise they might have to come a little bit closer. They will also explain the appeals procedure to you, which was also done at your workshop. But if you have any grievance with the outcome of your assessment, if you thought it was not conducted in the right way, then there is an appeals procedure that you can follow. The client is asked to be real, to be themselves, and to be honest, and not to do anything that they're not happy with. This won't damage your chances of passing, but make sure that they understand that, and the assessor will reinforce that. You can assume that the environment of the gym is well maintained, and the gym manager at that particular gym has taken care of all that for you, but you will need to reiterate that to your assessor once you get started. And again, do ask questions before you start. They're there to help you, and they're not there to intimidate you. In your practical assessment, there are basically 3 sections in the observed part of the assessment. The first section is about you starting the session, and there are 6 scoring criteria for that. Then you move on to the exercises themselves, and for each part of, or each type of exercise and each component of the workout, there are 15 elements of scoring criteria. And then the third part is the ending the session, and there are 4 parts to that which you're scored on. Starting the exercise session. The first part of starting the exercise session is that you have prepared the environment for your exercise program, which means that you have checked the equipment is in good working order and it is safe to use, and that there is a risk assessment in place that is up to date, which means you are minimizing the risk within that area, that the temperature and humidity are controlled, and that is kept that way, and you are ready to go for your exercise session. This part of the introduction to the session is that you welcome your client in the appropriate way. So if I was going to introduce myself, I would say, my name's Alison, I'm going to take you for your session today. Thank you for coming, and then say their name and shake their hand ideally. This is a bit of role play because obviously you know the person, but just make them feel comfortable and tell them what's going to happen. The third part of the session starting is that you have prepared all the health and safety parts to the session and let your client know, which includes them knowing where the fire exits are and what to do in the event of an emergency, and also that they understand that they should tell you if they feel like they don't want to do any particular exercise that you show them, so make sure they understand that they know where the water is and make sure that they have water with them, and that they've got the right clothing for the exercise session. The fourth part of the session introduction is that you have screened your client, and you also screen them today for exercise. A few weeks ago they would have filled in a PAR-Q, so if I was going to ask my client about their medical status, I would say, has anything changed since you completed that form medically? And they hopefully will say no. And you would also ask them, do you have a cold? Is there any reason you shouldn't exercise today, particularly running a fever, a temperature, particularly a chest infection, or any other reason why they should not exercise today? Do they feel well? The fifth part of starting the exercise session is telling the client what the purpose is and what's going to happen to make them feel more at home and less anxious. So you would say, today is about an introduction to exercise for you. It's going to take up to an hour in length, and I want you to tell me if there's anything I show you that you're not happy to do. I want you to be honest at all times in terms of how the exercise feels, whether it feels easy or difficult, and don't be afraid to do that. because that's really important, so we can find what you like and also what you don't like in terms of exercise, so that when the exercise plan is planned, then you're doing the best things for you. The final part of starting an exercise session is the assessor looking at what you're wearing and your physical appearance and your professionalism. So your clothing should be conservative, smart and clean, ready for exercise, but ready for teaching exercise. So long trousers, long sleeves or polo shirt, nothing too elaborate, and also hair tied back and no jewellery, particularly for exercise instructors. The other thing that you can introduce at this point in starting the exercise session is a quick briefing about posture and safe lifting techniques with your client. You can teach them a good postural position before they start the exercise, which means, if I was going to teach you, I would say, when you're standing with good posture, you want to stand with your feet about hip width apart and your knees slightly bent, so soft knees, and you want to have your back in a neutral position like so, with your shoulders relaxed and your chin parallel with the floor. Okay, so it's a case of trying to maintain that posture when you're exercising or standing. Also, if you're going to be bending down and changing machinery, you want to bend down with a good posture, which means bending the knees, keeping the back in a good posture, which means doing something here on the bike at a low level, and then just using the legs as opposed to bending over with the back. And that's something you can tell your client about at the beginning, but then reinforce that throughout the session. During the exercise session, each part of the exercise session, you're being scored on 15 scoring criteria that the assessor is following. The first one is that you demonstrated correct technique and safe use of the equipment. So, which means you've actually demonstrated the exercise and shown the client perfect technique and instructions for that particular exercise. That you've shown them it at the correct speed, and you've also shown them how to set up the exercise, how to get into the right position, how to change any adjustments on the machine to correctly fit their body before they start the exercise. Then you teach them and demonstrate the exercise itself, and then also you teach them how to get out of the exercise machine or return the weights to the rack. So you do 3 parts: setting up, the demonstration of the actual exercise, and the finishing. The second scoring criteria is that you gave clear and accurate explanations of the exercise to the client. So your voice is loud enough, and that you give the teaching points very clearly to the client, and that they can hear you, and then you repeat them when necessary. You verbally teach the client and you verbally talk them through the exercise as they are doing it as well. It's not enough just to show the verbalization when you're demonstrating. You have to verbalize and talk the client through the exercise as well. The third criteria is that you've selected safe and effective exercises. This is really important. You'll notice on the scoring sheet this is a shaded box, so you cannot get any of these wrong. So you select an exercise that works or stretches that particular muscle group, or you select an exercise that works an exercise cardiovascularly if that's the purpose. For example, in the warm-up, in the general warm-up, the CV warm-up part of that is a low-level exercise. So the purpose of that is just to loosen the body and to warm the body, get the muscles warm, get the joints lubricated. It's not to raise the heart rate significantly. For the warm-up, the mobility exercise is to warm the joints up. In the warm-up, the stretching is short, static, not very intense stretching. Or dynamic movements which are relaxed, and they're not going beyond range of motion, they're gentle. For the CV curve, the exercise is designed to increase the heart rate up to a level that is exercising the client to a good intensity, or the right intensity for them to get aerobic benefits, and for them then to cool them down from that. During the resistance training, however, in this particular session, it's an introduction to exercise on weights. So the weights are actually very light. So you have to adjust what you say to the client. They're not actually having a workout at this point. They're learning the exercises, so the weights will be light. So you need to explain that. In the CV cool down, the CV exercise is low level. Again, you're not looking to raise the heart rate. You're just looking to mobilize the joints, mobilize the body, and just reduce the heart rate actually gradually down after the exercise. So know what section you're in and know the purpose of that section and how to describe that to your client. And stick to the exercises in your course manual. Unless you double check them with us first before you use an exercise, make sure you use the exercises that are actually in the Level 2 Gym Instructor Manual. The fourth criteria is that you used supportive and motivational behaviour with your client. Supportive and motivational means you're saying things like, you're doing that really well because you've got your back in a good posture. You're doing that well because you've got your knees over your ankles, for example. So you're giving them real reason to believe you in that you think they're doing things well. So be genuinely interested and react to what they're doing. Section 5 of the scoring criteria, communicated with clients and accurately providing feedback and instructional points which are timely, clear and motivational. So that means that you have pre-planned your teaching points and that you've communicated those teaching points to your client properly. Now, some teaching points will be general and apply to most exercises, like keep breathing at all times, or maintain a slow, controlled speed for weight training, or hold the exercise statically for flexibility training. On each exercise, you must cue the range of motion. You must tell them where the exercise starts and finishes. So that's something that you can tell your client in real time. The exercise starts here and the range of motion finishes here, for example. So you must give them clear and concise instructions. You must also give them feedback. Now you can give feedback and teaching points at the same time. So you can say you're doing the exercise correctly because the speed is slow and controlled. So give feedback and teaching points at the same time. You must be motivational. So tell a person why they're doing it right and sound interested. So plan your teaching points and be clear and deliberate with your words. The sixth part of scoring criteria is adapted the exercise appropriately for the client when necessary. So to adapt an exercise means just to change the exercise very slightly. A good example would be a lying hamstring stretch. Let's say the client is not happy to have the leg straight on the floor and then bring the other leg up. Maybe they have low flexibility. So to adapt that exercise, what you can do is ask the client to bend the knee. Now you must preempt this happening and you must try to anticipate which exercise your client will require before you teach it. You really don't want to be adapting exercises for the client as they go along, because they then will feel as though they weren't good at that exercise and you had to adapt it down for them somehow. So if that happens, you need to bring it a positive into that situation. But that's an example of an adaptation. The seventh criteria is that you gave an appropriate alternative to the client. Get back up off the floor, then you will teach them a standing hamstring stretch instead of a lying hamstring stretch. Again, prepare for this, plan this, preempt what your client will or will not be able to do. Don't be in a situation where the client feels belittled or de-skilled with your changing your choice of exercises at the time. So the 8th criteria is that you monitored intensity appropriately for the client and the component of exercise. So you need to know your client's exercise history, which you will know, your current behaviour in terms of exercise, aerobically and weights and flexibility wise, so that you choose the exercises properly and that you monitor the intensity correctly. Now in the assessment, the warm-up will be quite real, the general warm-up, because the exercise on the CV part of the general warm-up is quite light anyway. And the exercises for the mobility and some short stretches are quite easy to learn, so you can use those at a set intensity. The CV curve, you need to tell people how that should feel, using the RPE scale, using heart rates, and you need to adjust that to their actual fitness level. Now there's no role playing going on here, you need to teach that at the right intensity for the exercise for that particular client. When you move to the weight training, however, the exercise intensity is going to be light. Now you have to tell your clients this, and that you're going to be using, we call them teaching weights. They're light, you're helping them to learn the exercise today. So they're going to be light, they're not going to feel heavy towards the end of the set or anything like that. Not how they would normally when a workout happens. You're just progressing towards that. In the cool down of this, after the weight training, the CV cool down is also light. That's how it should feel. And then at the end of the session, stretching. How should stretching feel? If your stretching is there to develop flexibility, then flexibility exercise should feel as though it's stretching the muscle to the point of tightness. Shouldn't feel discomfort, certainly not pain, but that is the intensity of stretching. Whereas stretching during a warm-up doesn't feel to that point, it feels light. So know what your purpose of the exercise section is and teach that appropriately to the client. The 9th scoring criteria is that you used and reinforced key instruction points to improve clients' performance and encourage independence. So this is about client learning and your teaching points. So used means you have to verbalize teaching points that are pre-planned. A teaching point is something like keep breathing during the exercise, or keep your elbows still at the side of your waist. That is a teaching point. Reinforced means you have to repeat these, and repetition means at least twice. So while you're demonstrating and while the client is performing the exercise and you're talking them through it, you have to repeat those at least twice. I would say 3 times is ideal, if not more. So don't feel strange by repeating things. The client will only learn if you repeat the key teaching points. And you need to encourage independence, so you have to find out what your client has learned from you at the end of the exercise. General teaching points would be things like use a slow and controlled movement, have constant breathing, and cueing the range of motion again, so telling them where in real time the exercise starts and finishes. So the exercise starts here up to this point here, and I'll demonstrate that when we come to looking at some of the exercises. A specific teaching point would be keeping your knee over your ankle, so directly above your ankle. Another specific teaching point would be keep your body upright and still. That would be another specific teaching point. Encouraging independence means you have to bring in a question at the end of the teach. You have to say something like, would you be happy to do that exercise again with less input from me next time? Do you feel you've learned something on that exercise? So the 10th scoring criteria is that you used appropriate teaching position to enable observation and correction of your client. So when you plan your exercises, you know where you want the client to stand when they observe you, and know where you're going to stand when you're observing them. tell your client where to stand, because they won't know. So don't be afraid and say, would it be okay for you to stand just there for me to watch it from this angle? And then I'm going to turn around and so you can see my back position from this angle, and just tell them, you know, you stand still, I'll turn around and show you from a different angle. So make sure that you do that. And if you see any things that need correcting on their technique, you must correct them. You must correct them positively. So yes, tell them something that they're doing well. You're doing the exercise well because the speed is good. Could I just ask you to bring your foot forward slightly, just so that your foot is beneath your knee, for example. So do make corrections and don't be afraid to do that. The 11th section of the scoring criteria is that you gained feedback from the client to check understanding of their performance. Now, whenever you ask the client how they think something went, if you don't give them something positive before that, they will probably say, well, not very well. So when you ask this question, you must give them some sort of positive feedback. For example, they've finished the bicep curl, you would say, you did that really well. It is easy to swing the elbows on a bicep curl, and you kept your elbows still all the time. That was really good. Then ask them, how do you think that went? And hopefully they're going to say something positive. The 12th scoring criteria section is that you demonstrated safe and effective lifting and passing techniques appropriate to each exercise. Some exercises this won't apply, but most it will. So that every time you're showing a client how to bend from the knees, keeping the back neutral, that you're making sure they're doing that, and they know why that they're doing that. They're doing that for safety and for good back care. So that you actually demonstrate this, perhaps at the beginning like I showed you earlier, and then definitely teach them how to lift weights from, let's say, a bench level or a rack level with a pair of dumbbells, for example, or a light bar, so that you can show them how to do that properly and safely, and then reinforce that and reiterate that technique throughout the exercise session. So the 13th criteria for scoring is that you manage the timings of the session effectively. So you must really plan your session well. The exercises that you're expected to do fit into an hour easily, but they do need to flow very well. I wouldn't practice this too much with the client that you're bringing on the day. Sometimes if you do too much practice with that particular client, it can be a little bit of a double act and things don't go so well. So practice it with other people, other instructors, and your teaching, and know that your timing is going to fit. Don't start off too slow at the beginning and then have to rush or even miss out exercises at the end. If you miss anything out, there's not going to be any score for that. So again, timing and practice for this particular component. The next part, the 14th scoring criteria, is that you selected the correct speed for exercise. So in resistance training, it's always going to be slow and controlled. So your demonstration should be that way, and you should coach your client in that way. And do make corrections on the speed. Now you can see on the scoring criteria that is another shaded box, really important. And so you do have to coach the correct speed of exercise at all times. The last scoring criteria for the exercise session is that you establish an effective working relationship with your client. Now, be genuine. Be genuinely interested in what they're doing. React to their performance, coach them, give them feedback in real time. Yes, correct if necessary, but show a genuine interest in your client. Using language like you and I think you're doing that really well, you've got your feet in the correct place, they're hip width apart, that's really good. So make sure that you use language like that so that you can get marks for this scoring criteria number 15. So the first part of your taught session is actually the first 2 columns in your checklist, which constitute the general warm-up. So we have the CV warm-up and the warm-up stretch, which can involve some mobility exercises for the joints as well. Now, starting now, we have our client here, Paul. Thanks for coming, Paul. Paul's going to do some of the exercises for me today. He's going to be my client. What I'm going to show you first, Paul, is to warm up, and we're going to warm up generally, and imagine, let's say we were going to do some weight training. I'm going to get you warm in the body, loosening in the joints and the muscles themselves. So we're going to start with the bike and use that for the warm up. Now when you're using the stationary bike, the seat has to be the right height to fit you. Now for me,